Well, good morning, everyone. I would like to talk about a study that we conducted and the general applications of ergotherapy. Well, the study is examining the sensory processing in children aged by 7 and 10 years. And actually we investigated the effect of occupational therapy on children with sub-threshold ADHD diagnosis. And we looked at the sub-threshold ADHD patients, whether ergotherapy is effective or not. Well, there are two categories of core symptoms, hyperactivity and impulsivity. And in this treatment, especially the behavioral therapy's role is pretty important, especially the psychological, neurological, and behavioral functions of children is important in the behavioral therapy. So, the symptoms begin at the age of 4, and step by step they actually improve and increase, and after 7 to 8 years of age hyperactive symptoms begin to decline, and by the adolescent years they may be barely seen. But actually the restlessness and uneasiness and coping with the social interactions actually they actually are seen throughout the life. Well, when we see the ergotherapy's role in ADHD, it's important in terms of activities of daily living, instrumental activities of daily living, rest and sleep, leisure and play, and social interaction. This is proven, and actually it's very important in the improvement of social skills, executive functioning, impulsivity, and motor coordination, and lots of studies actually proved that. But what about sub-threshold conditions? Actually, the sub-threshold data on disorders are not yet presented for a large population. But the sub-thresholds actually affect negatively the patient's quality of life and causes negative consequences, especially in terms of social relations and school performance. Well, I have one study to show you, and it says that neurodevelopmental disorders frequency are approximately 2.63 in sub-thresholds, and I think it's a quite high rate. And these negative effects that we mentioned implicates that subclinical cases should rather be treated like full syndrome cases than healthy controls. Well, the preventional studies can hamper new cases, at least delay the onset of clinical disorders. In the study for 20-week ergotherapy, we investigated its effect. Initially, 30 patients were included, but the follow-up was not that actually possible in all of them, so we followed up 20 of our patients. And before the therapy, target behaviors were identified for each child, and we used the done sensory profile by an occupational therapist, and each child's education was different because some of them had challenges about the motor functions, for example. There were lots of different training programs. As a child psychiatrist, I did my diagnosis with said, and with the DSM diagnostic criteria for ADHD was used to determine the sub-threshold ADHD, and then during the study, Connor's teachings and parents rating scale was performed. In a Canadian occupational performance measure, in this measure, the performance is targeted, and actually the result of it is measured. There are two dimensions. And ergotherapy was focused on family and children mainly. And some exercises were suggested for the children, and they were applied in the home. So the children actually performed 2 hours of ergotherapy a week. And when we look at the demographic characteristics, we had 11 males and 9 female patients, and 4 of them had high levels of academic performance. In terms of education of father, they had similar rates. We look at the education of mother, and these are the school years. Actually, in the 5th grade, we had 4 children, and the emotional profile was actually suitable for 7 and 10 years. So this was our demographic scale. And then we look at the CTRS and CPSQ scores, and there were a significant statistical significance was defined here, and we see a significant improvement. And we looked at in terms of performance scores, in terms of the satisfaction scores, 75% of the children have reported improved at the end of the program. And the children actually increased the study durations, for example. And the children actually wanted to sit on a chair for more hours, and we saw an improvement in that case. To conclude, especially in subthreshold disorders, they are presented like normal people. So in the high-risk groups, to prevent this disorder, ergotherapy plays a key role. The subclinical symptoms actually can be more easily improved with this ergotherapy. And actually, if there is not a full diagnosis of ADHD in this patient group, preventive studies are effective. This is proven. Thank you. Thank you for your attention.